The broadcast is now starting. All attendees are in listen-only mode.
And call the meeting to order. This is are we live?
Yes, ma'am.
All right. Good morning, and this is the virtual meeting of the Transportation Disadvantage Coordinating Board, Friday, August 21st, 2020. And if staff will call the roll, we'll establish a quorum.
Okay. Commissioner Smith,
Here.
Gloria Mills, Miss Mills, Glenn Brown,
Here.
Craig Purcell.
Here.
Okay, Gloria, thank you. Craig Purcell, David Newell, Emily Hugart, Clarity and Senate,
Yes, I'm here.
Angel Williams, Mark Harshberger, Nancy Castellano, Dr. Leslie Gordon.
I'm here. Good morning.
Good morning. Councilman Schischler,
Here.
John Pelkey, Nancy Pacifico, Cassandra Blaylock,
Good morning, I'm here.
Jody Toner,
Here.
Artie Fryer, Deborah Knoll, Mike Lacey.
Present.
All right. Do we have a quorum?
Yes, we do. We have 10 present.
All right. And do we have any public comment?
No, it does not look like we have public comment.
All right, thank you. Then our next item of business is to approve the minutes. Do I have a motion to approve?
I move to approve. This is Glenn.
Glenn Brown, yes. Is there a second?
Gloria, I second.
Who was that?
Gloria, I second.
Thank you. We
Gloria
have a
Mills.
motion. Thank you. We have a motion to approve by Glenn Brown, a second by Gloria Mills. Do we need to take a roll call vote, or can we just approve by everybody saying aye?
I think we can say aye.
Yes. All right. All in favor, say aye.
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 Any opposed?
I.
Okay. Thank you. And so the minutes are approved. And that takes us to our first action item. Mr. Barber.
Thank you, Madam Chair. Any formal presentation day for everyone. This is a follow-up item from the action the board took in June to transition the Tri-County LCB to an annual subcommittee. The role of the annual subcommittee will be to review and revise the regional priorities that were established in the Tri-County Access Plan in 2014 and provide them to the TMA leadership group. The TMA leadership group is a group of elected officials who speak for the Tri-County area with one voice and help prioritize state funds. So I'd like to ask the board to nominate one member and one alternate to serve on the Tri-County LCB. And I'm happy to answer any questions about that.
Thank you. And so this is, I have a few questions. Is there anyone else with any question or discussion? Let me let me get clear. Here, I'm trying to. It looks like my connection is having a little bit of trouble. So I'm just trying to get clear. Can you hear me?
Yes.
Yes, Madam Chair.
Hello, can you hear me? I think I will cut off my video, and that might save us some bandwidth there. So we've got the TMI and the LCB here, and the local coordinating board. There's a kind of a very complicated web of organization in our transportation bureaucracy around here. But if you could explain the local coordinating board and the its relationship to this TMA, that would be helpful.
Certainly. So for the past 10 years, there's been a tri-county local coordinating board who members are composed of different members from the local coordinating boards. So Hillsborough, Pinellas, and Pasco counties. And that tri-county LCB has been working over the past 10 years to help identify regional priorities and advance regional priorities within the region. That board was transitioned last month, 2 months ago in June, to an annual subcommittee whose responsibility will be to transmit regional priorities to the Transportation Management Area Leadership Group. And the TMA Leadership Group is responsible for speaking as one voice for the region. So they can receive and allocate state funds for the tri-county area.
And
so
yeah, I'm sorry, you finish.
that was all, Madam Chair.
Okay. And so now, what would be the responsibilities and of this board, the Disadvantaged Local Coordinating Board? How often would they meet? Just an annual, it looks like, this subcommittee?
Yes, this tri-county subcommittee will meet once a year to review and revise and create regional priorities. And then likely they will have a roundtable with the TMA leadership group sometime next year to discuss the regional priorities and kind of bring any concerns or needs forward to the tri-county region.
Great. And with that, does anyone else have any questions about this before we ask for maybe volunteers and nominations to appoint somebody to this?
I have a question. It's Glenn.
Yes, Mr. Brown, you're recognized.
Thank you. Just what sort of time commitment is this?
What kind
Mr.
of
Barber?
time commitment?
Yeah.
I can't imagine that'll be more than 4 or 5 hours over the course of the next year.
So 4 or 5 hours once per year to make recommendations for all 3 counties?
The only reason I say 4 or 5 is just to give a bit of a buffer. I would imagine the first meeting of the subcommittee will last maybe an hour and a half, and then the transmission to the TMA leadership group in the form of a roundtable is usually scheduled for about an hour and a half as well. And then any time to kind of personally review the priorities yourself and review those relevant documents, maybe another hour as well.
Thank you.
Yes, sir.
And I'm thinking that this representative would then coordinate with our committee and report back and advise us when when that once a year annual meeting was coming up, so that we could have any discussion with our representative that might help provide some perspective, frame the issues that person then represents from this group to that tri-county group. right? So we could
Yes.
schedule that.
Yes, Madam Chair.
So, I mean, to the point about time commitment and how this would work. Is there any other discussion? I have no way of seeing whether or not anybody raises their hand. So just, I'm afraid we'll have to just pipe up and ask to speak. All right. Seeing none, is there anybody who would like to either volunteer or nominate somebody to be the representative to this Tri-County Local Coordinating Board Subcommittee from this committee? Don't be shy. Otherwise, we'll have to just appoint someone. Who do we have here? Mr. Brown, were you considering being the representative?
I was thinking about it, but I'm not sure it's a good idea, just because it meets once a year. I'm not sure. Yeah, I'm not sure what the future holds.
Okay. I know Mr. Schisler is a hard worker. Ms. Mills, is there anyone who wants to step forward before we appoint someone or draft someone if we have to?
Excuse me, Gil Schusser, when's the first meeting going to be?
Yes, we're looking for sometime perhaps in October to meet for the first time.
Okay, I'll volunteer.
Thank you, Mr. Schisler. I guess we should thank you very much. I think we should have a vote and possibly a roll call vote to appoint Mr. Schisler as our representative to the local coordinating board. Can staff do that?
Commissioner Smith,
Yes.
Gloria Mills, Glenn Brown,
Yes.
Clarity and Senate,
Yes.
Dr. Leslie Gordon,
Yes.
Councilman Schisler, does he vote?
Yes.
Okay, John Pelkey, Cassandra Blaylock,
Yes.
Jody Toner,
Yes.
Mike Lacey,
Yeah.
motion passes unanimous 9-0.
Great. And thank you again, Mr. Schisler, for stepping up. We have our representative. And we move now to the status reports, starting with audible crosswalks. Mr. Bugle.
Madam Chair, before that, can we have an alternate as well?
Oh, all right. Sorry. Okay. The alternate for this position would be even easier than the main representative. But in case that Mr. Schisler cannot make the annual meeting for some reason, we should have an alternate ready to go. So is there anyone who would like to nominate someone or suggest someone else or nominate themselves by volunteering to be considered as an alternate for this position? It doesn't sound too time consuming. I can see a couple of microphones coming and going. Is there anybody who would step up to be the alternate? We may just have to leave that open.
Gloria Mills.
Yes, Ms.
Gloria
Mills, will you
Mills.
be-
I will volunteer to be the alternate.
Thank you. Thank you. That would be great. And, you know, if
I
you
will
could,
be the alternate.
yes, ma'am, Ms. Mills. So Ms. Mills has graciously volunteered to be the alternate, and let's have a roll call vote and appoint her for our alternate.
All right. Smith,
Yes.
Mills, Glenn Brown.
Yes.
Yes. Yes.
Okay. Senate,
Yes.
Gordon,
Yes.
Schisler,
Yes.
Pelkey,
Yes.
Blaylock,
Yes.
Toner,
Yes.
Lacey. Motion passes 10-0.
Great, thank you. And Ms. Mills, you may want to monitor the meeting in your role as alternate, if possible. And then you could help the role in that way, if you have time. Now, with that bit of business completed, let's move on to the status reports and hear about the audible crosswalks. I have Mr. Bugle.
I had coordinated with Mr. Bugle on this earlier this week. It doesn't appear that he is in our attendees or staff list currently. I know he was on leave through yesterday, so I'm worried that perhaps he is not in attendance of this meeting currently. I will send him an email real quick, just to double check. But we might want to move on to Dr. Jang's presentation.
That sounds good. And if he doesn't make it today, we can postpone that item until our next meeting.
That sounds good.
So our next item then is the Healthy Buddy program. Dr. Jang.
Yes, ma'am. So Joshua, yeah, you're showing that. Is it the latest version I sent you?
Yes, ma'am.
Okay. Alrighty. Good morning, everyone. My name is Siwon Jang. I'm with USF Center for Urban Transportation Research, Qatar. Today, I wanted to share our program, the Healthy Body program, which was done in Hillsborough County to improve transportation disadvantaged older adults' mobility. So I'm originally from public health. So working at Qatar, I was just trying to use some public health approaches to resolve some transportation issues around us. And I saw that if we could pair transportation disadvantaged older adults with our college students, there would be a great venue for them to help each other. So this program was just started from that idea, and we have been funded by two university DOT's university centers, CTEC and CTED. So just simply, as we know, I'm sorry, Joshua, do you think I can move the slide? Or are you gonna control that? Oh yeah, thanks.
I'll control it. Just let me know if you want to change slides.
Okay, so older adults, we know that they are growing really quickly, the population itself. So according to the US Census Bureau, older adults will outnumber children for the first time in US history by 2035. It's in like 15 years. Older adults, they are known as a group who are experiencing the greatest transportation disadvantages. Also, their driving cessation may exacerbate health conditions by delaying some necessary cares. So our Healthy Body program aimed to increase transportation disadvantaged older adults' mobility at the community level by pairing them with a trained student buddies. They're gonna help out to identify relevant resources and provide the information so that the older adults can use available resources in the community. So specifically, we wanted to provide some available resources for older adults' medical trips, their daily life activities. Also, we wanted to provide some like other health and transportation information at community level. Next. Next, please. Yep. So this is our phase 1 of the program. We did an in-depth literature review to see what's going on there overall for the transportation disadvantaged older adults. And we try to assess our existing resources in Hillsborough County. We did our own needs assessment working with our older adults participants. And based on the needs assessment and literature review and the assessment, the resource assessment, we were able to make some materials to implement the Healthy Body program. So finally, we made a website, hbody.org. It includes some transportation health resources, as well as some personalized page for each participant. Next, please. So for the community resource assessment, we contacted more than 30 agencies in Hillsborough County, including HART, our big partner. Also, we compiled some local health and transportation resources available for specifically older adults. Here is the thing. We found out that the transportation disadvantaged older adults, most of them, they are fitting into the low-income groups. So we wanted to find out some good resources to help them out. So the needs assessment included these like transportation agency contact and some local senior center step and mentors meetings. And we worked with USF College of Public Health to compile some relevant health information for older adults. Next. Yep. Our own needs assessment was done by some in-depth interviews with 14 older adults. We recruited them from Hillsborough County Senior Centers. So during the qualitative interviews, we introduced our program concept and showed the website so that they can just try if it is hard or easy to use. We also discussed their specific health and transportation needs. All the interviews were recorded and transcribed for some research purpose, and we counter-checked the national health data fits into our Hillsborough County samples, and fortunately, Hillsborough County older adults, they had some similar picture compared to the national one. So here are some key findings. For day-to-day transportation, our older adult participants, half of them, they said they rely on family and friends for their transportation use. And the half of them, they said they are using the public bus system. Also for their medical trips, about 30% of our respondents, they said they have their insurance, meaning that insurance companies, they provide the transportation. So if the older adults ask them saying, I have no transportation to be there, and they send their own shuttle, or they just coordinate some available transportation in the community. But it was only 1/3 of our respondents. About 20%, they say for their medical trips, they rely on their family and friends for a ride. And another 20%, they said they are using private transportation for medical trips, including like taxi, yellow cab, Uber, Lyft, and so on. Next, please. Yep. So it was interesting to see that about a little less than half, they were open to using public transit, but their issue was it's kind of hard to use. The bus stops are kind of far from their own places, so they cannot walk to there. Also, some participants, they replied that they have some fear about using public transit. So we wanted to try address these things when we did the sessions with our trained student buddies. Most of the participants, our sample groups, they were very open to using private transportation, but the barrier was the price. They think it's kind of expensive to use, but people who have used the private transportation, they liked it. Next, please. Also, if when we asked about our own program, they said if we provide some good information about available resources in the community, it would be helpful for them to move around. Also, they said our website was easy to navigate. So we tested a lot of times the font size. We have some avatar who reads the texts in the website, but for some technical limitation, based on our budget, we did not continue doing it. But when we tried that avatar function for older adults who have some vision issue, it was very welcomed. Next, please. Yep. So in the phase 1, the program development, we really focused on the program material development for our volunteer students. So as the website was finalized, we finalized the training presentation and some workshop for the students. And we developed a volunteer handbook for them to explore and refer to when they meet with their older adult buddies. And we had a separate session guide, meaning that basically the sessions are kind of 2 sessions were required so that they can meet with their older adults buddies at the first session for a needs assessment. For the second session, the student volunteers, they are supposed to provide some practical relevant information for that specific older adult buddy. So we wanted to develop a template for them to facilitate the sessions with their older buddies. Next, please. Okay, this is our program website. Specifically, the screenshot, the image here, it shows the personalized page for each older adult. So after the first session, once the student body comes back to the research team, the Qatar Transportation Committee, we figure out what available resources would fit into that specific older adult body's needs. So we entered all information there in this page so that they can log in, they can check the information and use. We also made all these information print ready so that they can print it out. Because some of them, I think almost half of the older adults who use the senior centers, they did not use their personal computers. Even if they have it, they are not familiar with using it. So we wanted to make it all print ready so that somebody can print it out and refer to it when they need the information. Also, the page, I'm sorry, could you go back to the previous one? Yep. Also, we have some message function connecting like between older adults and student buddies, not sharing their personal cell phone number or other personal information, but it seems like it was not like frequently used. Next, please. Yep. So this is the volunteer training materials. So I'll just skip the details, but these materials include very detailed information for student buddies to work with their older adult buddies. Next, please. Yep, these are our student assistants. We held a workshop for them, and we did some like role play using some like possible scenarios so that they can be ready to work with older adults. Next, please. This is our volunteer handbook. As I briefly mentioned, we just included all like necessary information as well as some tips to work with older adults successfully. Next. This is our session guide. So if you are the student who have been trained by the research team, you practice to go over this guide and apply this scenario to the sessions that you work with your older adult buddy. Next, please. So phase one was program development, including some qualitative interviews to figure out what information is really needed for the transportation disadvantaged older adults. Phase two was the program implementation, a small pilot test. Next. So this is the overview. When you look at the lighter green, the upper part, this is the student volunteer recruitment, their workshop, and buddy pairing. When you look at the bottom part, we recruited our older adult participants at the Hillsborough County Senior Centers, and we kind of screened them out based on our criteria. After we are done with the recruitment for both students and the older adults, we paired them based on their available schedules. So the paired buddies, they met in one of the senior centers to do the first session, and they reviewed the website. They just discussed the specific needs for their transportation use and some like health information, especially the chronic diseases they have, because USF Public Health recommended some good materials to share for older adults chronic disease management. So we included that information in our website. And during the first session, we introduced the pages so that the older adults can go to the website, check the information. So after the first session, they came back to the research team. We created some list of information they would, the older adults would be using. So the list goes to the second session with the student buddy, and the student buddy goes over the profile content, the list of the information, and try out like some buddies, they wanted to like try out during the session too, like calling the company and ask the price and time takes like that. So after session 2, we strongly recommended like continuing the sessions between the student bodies and older adults, but within our grant cycle, it did not happen because we were kind of, it took more time for us to complete the program, like completing the 2 sessions, doing pre and post survey and follow-up meetings. So we are just done with all the follow-ups. So because of the time frame, we did not push the further sessions, but at the end of the session 2, there was a finalized list of information which goes to the personalized page in the website. So we did some surveys for both groups, students and older adults, to see what they thought about the program and their experience and so on. Next. Yep. So we recruited a total of, we got, I think, about 15 students at the beginning, but because this is a research study, we had to go through really complicated IRB and other trainings that the university required. So we ended up with 11 students from social work course, and we had some public health students too. So based on the interviews in the first session, they recommended relevant resources to their health buddies. And as I just explained, they try to practically help the older adults to use available transportation and health resources in the community. So this is the picture that we worked with HEART. They have really good travel trainers. So we were able to have them. They came out to the center and they just willingly tried out this trip to a nearest grocery to the center they were at. Next, please. So we've got like a total of 62 older adults participants. Again, they are all from one of the Hillsborough County senior centers. So we wanted to have like intervention, the case group, and control group to compare the outcomes. And these these bullet points, they are our criteria to be. If you wanna join the program, you must be 65 or older, and you do not have a regular transportation for your trips, and you have at least one chronic health condition you are managing, and you do not have dementia symptoms. But this part was relatively easy because the senior centers, they just screen them out, the dementia patients. So dementia was not, there was only one case. We had to like withdraw the person's health condition was, mental health condition was kind of worse throughout the sessions. So we had to drop the case. But other than that, the older adults at the centers, they were all very good to work with. Next, please. Okay, so the 62 participants, the majority of them, they were female, and 92% they were single. And the majority of the participants, they were low income. And interestingly, half of the participants were Hispanic, and their education level was more than half them, they had a high school degree or less. So because of the Hispanic older adults participants, we had a translator, but it was hard to kind of continue the sessions as we scheduled because the percentage was much higher than we expected, because we expected like 10 to 20% of Hispanic older adults, but it was much more than that. Next. Okay, this is preliminary survey data because we are still working on the pre-post survey results to check if the program was really effective to improve the older adults' mobility issues. So based on the descriptive statistics, 63% of the participants, they said they cannot drive. And 42%, they've never used private transportation services. And half of participants said they use door-to-door services frequently. This is because of the Sunshine Shuttle they are using to commute between their places and the senior centers. That's door-to-door service. And interestingly, 43% they said they never use public transportation, but they were strongly interested in using it, like saying, look at the big bus, I want to use it, but I don't know how to use. So we wanted to address that point during the session. Also, many participants, they said they just fully rely on children or other family members, followed closely by public services. So, yeah, next, please. This is another question we asked. So in the past 6 weeks, almost half of the participants, they said they did not have transportation for shopping or similar events, which is really unfortunate. And over a quarter, they were unable to travel to a medical or dental appointment, so they had to cancel or miss the appointments. So currently, we are finalizing the pre-post data analysis. As a researcher, my concern is the sample size is kind of small to test the real effects of the program, but having this type of community-based mentorship program, like buddy program between the college students and older adults who need some information from the community, I think that the existence of this type of program is meaningful. Next, please. So currently we are doing phase 3. We've submitted a research proposal for a small funding for Spanish language using older adults because the half of our sample, they were Hispanic. So we were able to secure some small grant to test how about the Spanish version of the Healthy Body program. So we are doing it here in Hillsborough County again. And we have another like partner area in Texas, the University of Texas Arlington. They are replicating the same program in Spanish. So we scheduled to start the Spanish version from the summer this year, but because of the COVID-19, we cannot do the in-person meetings, the sessions. So we've changed the format to online version. So we are working on it now. So we are hoping that from the fall semester, we could just start the new format working with our older adults. So we are in process of recruiting older adults from the senior center and the bilingual students from the University of South Florida. Next step would be, we are thinking that if we could have like online resource center, which includes all these materials for older adults, their caregivers, and community volunteers, including college students, that would be just awesome. And that would be a great way to have this, the sustainability for this program. That's it. Do you have any question?
Thank you very much. That's
Hi.
a very thorough presentation. Is there any questions from the board? I'm sorry that there's no hand raising function. You can type into chat if you've got that capability, or just sing out, and we'll try to organize you.
Looks like Glenn and Gilbert both have questions. I'll let Gilbert go first.
Thank you.
Thank you, Madam Chair. Dr. Chang?
Yes.
Yes, okay. Just one quick question. You said Hillsborough County Senior Centers. Did anybody reach out to the Temple Terrace Senior Center, which is about 3 miles away from Cutter?
Good question.
Temple Terrace, is it the name of the center or does it have any like other name?
It's the Lightfoot Senior Center, I think is what the full name is. Do you know if anybody's reached out? If not, I will have somebody get in touch with you, because that would be, you know, a very close laboratory for you to work with.
That would be great. We worked with the Oaks Senior Center and Town and Country, and one in Brandon.
Okay.
Actually, I think we reached out all the senior centers, but we kind of had to work with some responsive ones.
Okay.
It would be great if you could introduce Temple Terrace Senior Center.
I will get you two hooked up. Thank you very much. Very good presentation. I appreciate
Thank
the
you.
information.
Thank you.
Thank you. Mr. Brown, you're recognized.
Thank you. Appreciate it. It's nice to see a project where the theory of change is compassion for everyone involved. Appreciate that. You mentioned sustainability, and that's sort of the question I have. Is this something the university would be interested in supporting over time and in a partnership with the county, or is this something, I mean, it's a great project. There's some really cool stuff you're doing. However, when the grant money runs out and the study finishes, what happens to these seniors? And although the students have a very important and good experience, and hopefully we'll carry that forward, but what happens to these folks if
That's
the
a very
grant?
good question. Actually, we have been kind of struggling with securing the money from the phase 1, because as I just briefly explained, this was my kind of personal passion that I want to link the available resources to our older adults who need transportation resources. So we were fortunate enough to secure year 1, 2, and 3 fundings, but from 4, especially for the online resource center, currently, unfortunately, we have no idea. So as the Spanish version goes, I will just more actively look out if there are any opportunity in the county, or any funding source would be helpful, because we could make it online 100%, and we will need to do some pilot for people to use it. And then I think the minimal administrative support would be needed. So yeah, any type of funding would be helpful. If you have any good idea about that, let me know.
Thank
What year are you in?
I'm sorry?
What year are you currently in? You said you had 3 years worth of funding.
Yeah. This is our 4th year, and
Wow.
our funding 4th.
Okay.
And our funding ends early next year, 2021. But there should be a little delay because of COVID-19.
Thank you. Do we have any other questions from the panelists? No, seeing none. Thank you very much for this presentation. It's very informative, and it seems like a wonderful project to help our citizens engage with transportation in our community. Thank you very much. I'd like to stay posted and understand. We do have, like Mr. Schisler says, we do have some other senior centers throughout the county, and like to make sure that they can avail themselves of this service as long as you have funding. So, because I know that in South Hillsborough County too, that that could possibly be helped in this way, although there's not that much opportunity for transit there, but they could understand what the options are.
Yep, sounds good.
All right, thank you very much. Thanks for being with us today. Is that that takes us to the performance evaluation of e-scooters presentation. Dr. Zhang is,
Yes, I'm here. Unfortunately, I don't know why I cannot share my camera. My camera is not working for the GoToWebinar. So, but you can hear my voice, right?
yes, we hear you.
Okay. And you can also see my screen?
Yes.
Okay, great. All right, thank you for this opportunity to present you the outcomes of the performance evaluation of e-scooter sharing for the city of Tampa. So my name is Yu Zhang, and I'm leading the Smart Urban Mobility Center at USF. And this project is, I worked together with my colleague, Jason Jackman from Qatar, also my student, Yijie Guo, and also Seth Cherry Ang. So in this presentation, I first talk about this program and also what is the methodology that we used to do the evaluation and what are the data sources that we collected for calculate those evaluation metrics. And also we did the survey, and from the survey, we summarized the public opinions on some key questions. And also I will mention that some public meetings with the disadvantaged groups, and they provide the feedbacks and suggestions to the e-scooter sharing program as well. And finally, I will summarize the major findings and with the recommendations that we offered to the city of Tampa for carrying forward the e-scooter sharing program. So the data that we obtained was from the May 28th, right after the launch of the e-scooter program, to the March 9th. But actually recently in the final report, we extended that into the April and the May. And why we only present here up to the March 9th is because March 9 is the day that the governor called the action responding to pandemic. And that actually affected a lot about the commuting of the general public, and also some of, I believe, 2 of the e-scooter sharing companies actually withdrew their vehicles from the streets by that day. So that affects a lot of the ridership after that particular date, and we do not want to include that into our evaluation because that will twist the results. So within this time period from May 28 to March 9th, there are total about 982,000 trips, and the average daily trips are 3,423, and the average trip length is 1.14 miles, and the trip time is about 15 minutes. And on the map on the right, it actually shows the boundary of where the program is implemented. So here's the figures about the program overview. On the left side is the daily trip counts by the month. So we go from the June to the February, and we see that at the beginning, the daily trip is higher, but in November, December, it goes down, and the February it's about 2,600. And we also looked into the utilization ratio. This means how many times that one e-scooter used by different checkout. So in June, right after the launch, the utilization ratio is pretty high, which means every day each scooter actually averagely being used by 4 times. But then after that, in January and February, it went down to about 1.5. And we also look into nationwide data, and the 1.5 is a little bit lower than the other cities with a similar size. And on the right side is the daily trip counts by the day of the week. And the Saturday has the highest daily trip counts. And Friday and the Sundays are a little bit higher, and other days are almost the same. And we also look into the time of the day, which means how the usage of the program actually distributed during the time. and we show the weekdays and the weekend in different colors. So the weekdays is a blue color and the weekend is the orange color. So during the weekend, we see a big peak in the afternoon. And the weekdays also show the peak in the afternoon, but the magnitude is smaller, about half of what has been shown on the weekend. So the city of Tampa wanted to understand how the program works and also understand the impact of the program to the multimodal transportation in the city. So the framework is that we look into different evaluation metrics, including economic impact, environmental, health and safety, equity, and also the level of service that's provided by different operators. And we also collect the public opinion and the public feedbacks. So the data source, the first data source is operational data. With the help of Populous, which is a data platform company, we obtained the operational data. And the second is the survey. So we create the survey questionnaire and we disseminate the survey to the local communities through like MPO channel, through the City of Tampa social media, and through sending email to different HOAs. And we also obtained accident data from Tampa General Hospital and also asked the safety related questions in the survey. Now, besides that, there's a call log data, basically is record the calls from the general public regarding the pilot program. And also there's some comments on the critical issues from the survey and also coming from the meetings with the disability groups. So let's look into the outcomes of the evaluation, starting from the economic impact. So the economic impact, the first thing is the time saving. How did we do that? So according to the survey results, in the survey, we asked the questions about if they didn't use the e-scooter, then what other transportation mode they're going to use. And then we asked them to compare the time that they spend on the trip by using the e-scooter and the time that they would have spent if they choose the other transportation mode when the e-scooter program is not available. So according to that survey, we found out the average each trip would save 5.5 minutes. And then because we know how many trips within the time period that I have shown, so in total, we found out there are 5.4 million minutes actually has been saved because of the e-scooter program. And we also then use the time of value, which is 7.91 per hour, according to the Texas Transportation Institute research. And then the 5.4 million minutes actually would be round to about $2.29 million. And the second economic impact would be improved mobility. So the question in the survey is that if there's no e-scooter, what kind of other modes you're going to choose? Or you may choose not making the trips. So there 5.54% of the results shows if there's no e-scooters, then they would not make the trip. And that 5.54% actually lead to 54,000 trips. So that is another kind of benefit of the program, which is, induced some of the trips that could not be there if the e-scooter is not available. However, there's an other side of the story because we see that some of the trips are switched from driving their own vehicle, but also there's a certain percentage of the trips coming from who could have used the public transit. So according to the survey results, 1.08% of trips would have taken the hotline bus if the program was unavailable. So we assume that the bus trip would cost $2. Then if that's the case, then we found out, due to the e-scooter program, there will be a revenue loss to the HOT and it's about $21,000. We also looked into the trip purposes of the e-scooter sharing and found out most of the trips, 57% actually used for the social and entertainment. And when we look at the map on the right side, it shows a lot of the social and entertainment activities actually occurred in the central downtown area. So the central downtown area could benefit the most because of the e-scooter sharing program. Now let's get into this environmental impact. So according to the survey, if they haven't used the e-scooter, then the 45.5% would have driven their own private vehicles. From that perspective, we have seen the reduced vehicle usage because of the e-scooter sharing. And when we look into the average trip length of the trips, we found out those 45.5% actually leads to 500,690 miles. And then we used the emission rates to calculate what are the greenhouse gas emissions corresponding to this 500,000 miles. And it shows it will be 202.4 tons of carbon dioxide, 1.75.4 kilograms of the hydrocarbons, and others, including exhausting carbon monoxide, etc., etc. So those are the traffic emission reduction thanks to the e-scooter sharing program. And also we looked into what is the average miles per vehicle travel in our region. And once we found that number, we used 500,690 to divide that number, and we found out it's equivalent to remove 47 vehicles off the road. So those are the environmental impacts. The next evaluation metric is regarding the equity. So first we look into the horizontal equity, which means spatial distribution. And we found that the spatial distribution actually varies significantly among the different areas. So when we look at the map, on the left side, it shows the e-scooter distribution at the census tract level. And the dark color means there are more deployment of the e-scooters. And the light color means there are fewer. And we see most of the outside of the downtown area has fewer e-scooters deployed. So it's not evenly distributed, and also it's not distributed proportionally to the population. And of course, the operators are profit driven. You know, they want to deploy e-scooters where there are more trips. So later we will talk about, you know, why the areas on the edge of the program boundary, actually there are fewer trips generated. So here just to show, kind of emphasize again about the pickup and also drop off. For the pickup and the drop off, they do not show significant difference. When we look at these two tables, they're almost the same. The next one is the vertical equity. So we want to, the one thing is we look into the e-scooter usage and also the coverage among the areas with the different poverty ratio. So the first map on the left shows the poverty ratio of the census area, and the darker color means there are higher percentage of people under the poverty threshold. And the middle map shows the e-scooter distribution, and then the map on the right shows the e-scooter pickup. So we see that the distribution, the deployment of the e-scooters actually concentrated more in the areas with lower poverty ratio, especially in the central downtown area. And as I mentioned, you know, the operators are profit driven, And in the areas with the higher ratio of the poverty, actually fewer people would use the e-scooter. And it happened that they had some e-scooters sitting there without being used for 3 or 4 days. And another thing is, from the survey, we found out the users are mainly male with a high income and in the race of the Caucasian. And it's also in proportional to the population, social demographic distribution of the population in the city. And here, so the three figures just to show the gender. Most of users are male, and most of users, about 75% of them are white people. And this is the users in falling into different annual household income bin, and many of them has income higher than $100,000. So the next metric is health and safety, and we collect the data from the Tampa General Hospital, and we found out that the accident count actually goes along with the e-scooter usage. So when we, the bar shows the average daily trips, and the orange curve shows the accidents. But I want to point out is there's no specific code in hospital to record if it's related to the shared e-scooter or related to the e-scooter owned by the user themselves. So what we suggested to the city is, working together with the hospital, try to record the accident related to e-scooter particular with a special code in the future. And although the numbers are higher when the e-scooter usage raised, but most of the injuries are very minor. And a lot of the injuries occurred when the users actually fall down from the e-scooter because they are not used to use that the vehicle. So here shows the different collision types. And as I mentioned, almost 62% actually are falling down from the e-scooter without colliding into anyone. And 56 shows very minor injuries. And the severe injury level is about 0.7%. And in the survey, we also asked questions related to health and safety. And according to the survey, 44.5% of users would have walked or cycled if e-scooters were available. So that is actually could be the negative impact, which means the e-scooters reduced the active movement and active transportation of the users. And also it shows in terms of the right of way, lots of the publics, they do not feel safe when the e-scooters are ridden on the sidewalk. And some of them are feeling not safe when they're riding on the street lanes, and most of them are the drivers who drive the vehicles on the street lanes. So certainly, there's still lots to do to improve the safety and also to come up with the better ideas about how to share the right of way of the roads for different street users. We also look into the different vendors' level surveys. We look in this again shows the utilization ratio, and as I mentioned, with the program going forward, especially in January, February, the utilization ratio actually reduced. So the vendors need to come up with some method, to better dynamically responding to the demand, and that's to increase the usage of the e-scooters. We also look into the different level service evaluation criteria. For example, to show if the smartphone app is user-friendly, if it's easy to find the usable e-scooters, and also ask the questions about, if the price is reasonable, if the e-scooter itself is easy to use, or if the company is responsive to requests, concerns, or questions. So most of the companies actually get quite high score because the score is from 1 to 5. So many of them, mean is 4.4, and the variance is very small, which means there are not huge difference between the operators. Now, the second part is we look into the public opinions on the key questions. So most of these come from the survey. And the survey first asked about the right-of-way. So it shows that the bike lane, the separate bike lane actually is more desired, both by the users and non-users. When the users are using the bike lane, they feel safer. And when non-users sees the e-scooters in the bike lane, they feel so safer. And the second one is the rules and the regulations. So we try to see if the users are familiar with the e-scooters rules and regulations. And we did a 2 dissemination of the survey, so we have outcomes from 2 surveys. And it shows that, you know, the familiarity with the e-scooter rules and the regulations actually didn't change too much in 4 or 5 months between these 2 surveys. For example, the first question listed here is a riding e-scooter is allowed on the street lanes. And the answer should be true, but only about half of the surveyees respondents actually get the right answer. And the same thing for the question is that people without driver license permit can also ride the shared e-scooters. That is false, and only about half of people know the right answer. Another question is regarding the concerns. So we ask the questions in the column, and we separate the answers into users and non-users, because for users and non-users, their concerns sometimes is different, and the percentage clearly show that's the case. For example, e-scooter users do not follow the regulation. 76% of the users are concerned about that, but for the non-users, the percentage is much higher. 90% of them actually concerned that the users do not follow regulation, like improper parking, like exceed the imposed speed limit, etc., etc. So in summary, I will not go into all the details, but in summary is users and non-users have different concerns, and the improper user behavior is the most concerned issue. And in terms of speed limit, we also ask the questions, what speed you think is safe? So the blue bar shows the user and the orange bar shows the non-user. So it's, you know, it's very obvious that for the non-user, they hope that the speed limit is lower, but for the user, they think 15 to 20 miles per hour is very reasonable. Okay, next. So next question is, do you think the program should be continued or not? And for first survey, we just give the yes or no answers. But for the second survey, given the responses from the first survey, we actually adjusted the answers. We include that should continue without any adjustment, needs some adjustment if it's continue, or needs a substantial adjustment if it's continue. And then is, you know, the e-scooter just should be discontinued. So for the second survey, there's more options. And then we also see that the users love the program and they think it should be continued. But for the non-users, when you say yes or no, many of the non-users says we should not have it. But when we give more options, says if we adjust the program to make it better, make it safer, then do you think it should be continued? Then the majority of them saying yes, it should be continued with adjustments. The city of Tampa also want to know if they should also encourage operators to provide the seated e-scooters besides the standing one. And the users and non-users have a slightly different opinion, but it looks the standing e-scooter is still preferred by all users and non-users. And this is just showing the performance of the different vendors. As I mentioned, the vendors performed very similar to each other. There's not huge kind of preference from one to the other. And the next question is, we asked if there should be a single vendor or multiple vendors. Why we ask that question is because in some other cities, they only give the permit to the single vendors for 2 or 3 years, and then they will do the bidding again. So, however, most of the respondents still think that we should have the multiple vendors. Then the users could have more options, and then maybe have a better competition of the vendors. Then it could provide good service to the users. So there's some feedback from the public. One resource is the call log data. So the call log data, most of them are complaints, and some of them are supportive feedback, and the public just call to express their support to the program. So we did this figure showing the first on the left is a complaint including a person who made 82 reports. So those are the complaints, total complaints from the May to the March. And a lot of complaints occurred in June and July, and most of them are related to what they call abandoned scooters. Actually, from our point of view, it's improper parking of the scooters. And a lot of time, the users parked in front of the private property, or park in the area, maybe block the sidewalk, etc., etc. So a lot of the public actually called in and complained about that. Another complaint is about behavior, and that is related to the speeding. Another category of the complaints is in the Bayshore and the Riverwalk. Actually, there's no riding zone, but they ride it in those zones. And we talked to the operator. The operator mentioned is that the speed needs a little bit time to slow down, and the no riding zone has lots of the access points. So it's easy for the users get into the no riding zone from different access points. And then when they get into non-riding zone, the speed actually didn't reduce to under the certain thresholds. And then in the system, it will show as they violated the non-riding zone restriction. And as I mentioned, in the total complaints, actually there's one person reported 82 times. So that person called in 82 times, complained a lot of different things. And then we removed the reports from that particular person and look into the distribution again. We see the same trends. There are a lot of complaints in the June and July, but the magnitude is much lower. And then later in Jan, February, March, there are very, very few calling in. So we summarized the call log, and we also looked into the record of each call, try to understand what they complained with, what they were talking about. And most of the calls were made at the beginning of the program. And as I mentioned, they complained about abandoned scooters, left the e-scooter at the private properties. And some of them saying that they said that they didn't like how the city looks with the e-scooter all of the streets. And some complained about the behavior, faster speed riding on the sidewalks. Somebody said the speed actually, it looks the speed are higher than 20 miles per hour. And another thing is the no rider zone. Some people see the high speed riding in those zones. And there's a certain percentage they call in to show the supportive. They hope that program could continue in the future. And they also give some suggestions to improve the program. For example, provide more docking stations, or give more chargeable docks in the city. And in the survey, we also asked about the comments. So what do you think the program could be better? And then we summarize the comments from non-users and also from the users. So from non-users, 30% of them says that the parking could be improved. And another 12% and 13% is about the violation of the traffic rules. So they suggested that they could, educate the users better so that they will not violate the traffic rules. And others are talking about sidewalk riding. They hope that more users could use the bicycle lanes instead of the sidewalk. And for users, they also are concerned about the parking issue. They think the parking should be improved. And another thing is the violation of the traffic rules, although the percentage is much lower. And they also concerned about the safety issues. Another thing is they think the city shall enforce the bike lane riding as well. So during this project, we observed how the program is used, and we took a lot of pictures. And here just to show some examples about the abuse of the program, the improper e-scooter parking, the unsafe riding behavior with the 2 people on the e-scooter together. And, there's one kid in front of it. And we also see the scooter being dumped into the garage garbage can. So what are the suggestions and the feedbacks from the disability groups and also from the National Federation of Blind? And in summary, they say that the improper e-scooter parking blocked the sidewalk, and they suggested that the e-scooters should not be put everywhere, should be returned back to the designated areas. And the second is, should ban the e-scooter riding on the sidewalk, only allow them to on the bike lanes or the street lanes, normal street lanes. And there should be more policeman enforcement about the rules. And they also suggested that there should be different type of equipment that can be used by the families with the disabilities. And also for the around the riverwalk area, they hope there could be more adaptive bikes and also the e-scooters. Another thing is in terms of how the disadvantaged groups or disabilities using the smartphone app or the website to reserve the e-scooters or check out the e-scooters. They think that the operators, the vendors could do a better job to make that even more user-friendly. So here are some major findings from this evaluation. We found out that the e-scooter sharing improved the people's mobility in downtown area. However, the equity is an issue, the spatially and also for the disadvantaged group areas, the deployment is different and the accessibility to the e-scooters are also different. And the safety concern is mostly complained by the public, and other complained issues are improper riding behavior, improper parking, faster speed of sidewalk riding, and the lack of the law enforcement. And another thing is regarding the no riding zone. I think the geofencing should be improved. So there should be a buffer zone, connect the normal zone with the no riding zone to prevent the e-scooters getting into the no riding zone with a high speed. So the geofencing zone basically is controlled by the vendors. And when the e-scooters getting into the geofenced no riding zone, the speed of the e-scooters will automatically lower down. But if there's no buffer area, then they cannot guarantee the reduction of the speed to the proper level when the e-scooters get into the no rider zone. A lot of people think that e-scooter is more suitable to be ridden on a bike lane. So later we have some suggestions to the city regarding, to improve the bike lanes in the city to make it all connected. And we find that performance of vendors are very similar, and they are doing a lot of things try to improve, the level of service and attract to the users. Another thing is utilization ratio of the e-scooter has been decreased since the debut of the program. And I think the vendors and the cities should work together to improve that, because I think the benefit of the e-scooters as one type of the micromobility is to let people have more mobility, more accessibility to this different transportation mode. And the sharing is a key. So we hope that the e-scooters could be used by more different people during the day. So here are some recommendations. It's just it's not a complete list, and in the final report actually we listed more. So the first thing is we suggested that the city considering constructing more connected and protected bike lane network. And also we hope the cities could expand the program to the other areas of the city so that more population, more people can benefit from this micromobility. And the second part is regarding the service provider, what they can do. The service providers could have more staff to respond to the complaints, and also they need to respond quickly to those e-scooters being parked improperly. And also they should monitor the utilization ratio of the e-scooter and then adjust the deployment of the e-scooter to responding to the dynamically changed demand. And another thing is they could offer seated or other type of e-scooters, even the e-scooters with some cargo capacity that people can use when they go for the grocery shopping. And they should offer some other types that could serve the disabilities. And another thing is related to how to make the e-scooters more fair to all different people. So there are a couple of suggestions. One thing is we could set the minimum number of e-scooters deployed in disadvantaged areas to improve the equity. Second is, which not showing here, is that we suggest the city could consider some discounted program, working together with the vendor. So the city could set up some system that the low-income population can register. And then once they register on their website, they can enroll into the discounted program and then can pay discounted rate to the vendors when they use the e-scooters. And the cost could be borne by both the vendors and also the cities from the fee that they charge the vendors for using, for deploying the program in the city. And another thing is the e-scooters should be banned on some of the busy sidewalks. So we need to distinguish the sidewalks with no pedestrian population flow or some sidewalks with higher pedestrian flow. Because in many areas, we do not have the bike lanes. And some people, they will feel unsafe if they mixed with the vehicles on the street lanes. Another thing is set the different speed limits for the sidewalk and the bike lane. So maybe for the sidewalk, it could be 10 miles per hour or at most 15. And if they ride on the bicycle lanes, it could go up to 20 miles per hour. Another thing is for the no ride zone, we need more warning signage and also provide more designated parking corridors and to improve the law enforcement. And for the law enforcement, also we suggested there are special code to record the accidents specifically related to the shared e-scooter. Another thing is the city should keep monitoring the safety, monitoring the operation of the program and track its performance continuously and keep communicating with the vendors to see how we can improve the safety, efficiency, and equity of the program. So this is all what I want to present today, and welcome any questions and comments. Thank you very much.
Thank you very much. That's very interesting on a topic of concern, I know, throughout our community. Do we have any questions from the panelists for the presenter? Yes,
do.
Mr. Brown.
Hi again. That was actually, yeah, very, very thoughtful. And thank you for coming around to the transportation disadvantage component that we meet as for a board. So thank you for trying to think about those things. And I do also appreciate your thoughtfulness toward trying to look at how these groups the companies are doing their work in relation to the city and where the neighborhoods that are low income with transportation challenges aren't getting served in the same way. And it sounds like in part because understandably they were looking to get piloted and make some money. I was just wondering, had you ever applied any of there's a physical geographer, a human geographer by the name of Torstein Hagerstrand, I think is his name. And he always had this in sort of foundational to his work is this diamond of capability constraints, sampling constraints, and authority constraints toward our time and space. And so time and space being the more control we have of our own time and space, we tend to have the ability to do more enriching things for ourselves rather than working through the process of getting to things. So a lot of times in the low income neighborhoods, you will have to spend a couple hours on buses to get and go somewhere. And if you didn't have the right form, you got to come back another day and start all over again. Whereas ideally, this sort of micro transportation, this micro mobility, theoretically could cut down on some of that time. Have you looked at sort of the economics in that way as you've thought toward?
Yes. I think City of Tampa is very, I think, pioneering in embracing the micromobility. So it was kind of affected by pandemic. It slowed down the process, but actually, USF. I'm particularly working with the City of Tampa to look into a more larger micro-mobility program that will be deployed for the whole city and including all different types of the equipment, including bikes, e-bikes, and e-scooters. So those e-bikes is like you still need to pedal, but there's electricity assistance. So in that way, actually, the e-bikes could be used for longer trips. And by having that types of the equipment, we could see that serve the population need to go on longer trip, but without very well public transit access and also the public transit network coverage. So if we have a more comprehensive micro-mobility program in the near future, then it will improve a lot about the mobility of the low-income population currently rely on the public transit and has to spend a long time, go from one route to transfer to the other route to get to the destination. But also, as I mentioned, I think the discounted program would be very important because even if we have the comprehensive micro-mobility program, but if the cost is too high, not comparable with the public transit fare that they're paying right now, then they probably would not switch, right? So I think we need to have the equity, what I call equity regulation tool, to combine different methods that could, facilitate the needs and also have financially support the needs from the low-income population. And you mentioned the name of is that a researcher or the author?
Yeah, it's a few years, a while back ago. I'm an applied anthropologist. His name is Thorsten Hagerstand, and I believe he's a human geographer, and he has a sort of diamond of access, and it's a time and space sort of measure. And so you can find a way how you're spending your time in relation to your space and relationships. So it's used in social network analysis and that sort of thing.
Okay, that's very interesting. Yeah, I would like to look into. I also want to mention, you know, that Dr. John just presented that work, and that work is partially supported by CTAC, which is Center for Transportation, Environment and Community Health. And I'm the USF PI on that center. So that is a center supported by US DOT. And with the support of that center, we are starting a project to look into the mobility desert. So you probably have heard about the transit desert, which means there's some areas that has no access to the transit network, so that they encounter some difficulties of making the trips. But from our point of view, we not only look into the transit, but we should also look into all different different types of transportation modes. Because for one area, if it has no transit accessibility, but if the area is a high income area, then the impact is negligible. But if it's a low income area, then the impact is very significant. So we need to distinguish that and consider multi-modal transportation and identify those deserts with really severe mobility issues.
Thank you.
Thank you.
Mr. Brown, did you have further questions?
Just thank you.
Is there anyone else on the panel with questions or comments? No, I very much appreciate the discussion of equity in terms of alternate transit and transportation options as well, especially for this committee. You know, one question that I had was in analyzing and figuring out how much money is being saved or revenue taken from HART or reduced vehicle use. I'm not sure that it doesn't seem to me if we simply say, well, how much did each scooter trip, how much time did each scooter trip save? An average of 5 minutes. All right, how much does some institute say that time is worth? $17.91 an hour. Then we can say we're saving $2.29 million a year because if I'm going to take a scooter ride and it saves me, say, 5 minutes, that time, if it's just 5 minutes out of my day that I didn't walk, is not as valuable as if you could aggregate all that time into a useful block of an hour that I could actually be accomplishing something or making some money or earning some money in some way. So while that's an average for everybody, I don't think each person saving 3 minutes, 6 minutes, average 5 minutes really is worth as much as $17.91 an hour average for what human time is worth in this country, whatever.
Yeah, that's a very tough question. I mean, it's a question beyond the scope of our research. There are lots of discussion about how to value the time, and it's really dependent on how you're going to use the time, right? If it's a leisure time or if it's working time, if it's commuting time. Yeah, so the reports that I mentioned, they just they try to value the transportation time. So, you know, I cannot explain the detail how they did that, but that is kind of the parameter that we usually use to calculate the value time of transportation. But I totally agree with you that the leisure time and the working time, the value could be different. And sometimes, people probably value the leisure time even more, because the leisure time you can spend with your family members, you can meet with your friends, or you can do the volunteers for some, good things. So it's really hard to put everything into the value. And I totally agree with you. It's just a way that we do some quantitative measure. And when we do that, if we look into other transportation modes and we use the same parameter, then we can do the comparison between different modes.
Mm-hmm.
So,
and one
yeah.
last question: the reduction of vehicle miles traveled and the pollution and everything by having scooters available. I wonder if you are calculating, well, would that person be walking? Would that person be taking heart services? Because I know you had pointed out that there is some reduction of use of heart, so a reduction of revenue loss to heart. So if there's this reduction in vehicle miles and the pollution, if the e-scooters were not available and those people were using heart instead, or riding a bike instead, I mean, I get it if they're doing that instead of driving their car, but is that the only group that you're calculating, is those that would have gotten in their car and driven, or gotten an Uber and driven?
So for this one, we just look into the driving the private vehicles. So we didn't look, I think this is a big chunk of the traffic emission reduction, but we didn't compare. For example, somebody, they used to walk or riding a bicycle, now they switch to e-scooters. And the e-scooters, there's electricity need to be used. And then we need to trace, where the electricity coming from and how much emissions that would generate. We didn't do that part. So what we did is we focused on, if there's no e-scooters, then 45.5% of the trips will be done by driving the private vehicle. So we only looked at this part.
Okay, thank you very much. Any other questions before we move on with the rest of this agenda? Seeing none, thank you very much for coming and presenting. This is all very, very interesting.
Thank you for having me. Thank you. Okay.
So now we're going to the old business, and I'm going to ask if we can't, old business and new business, and with these updates on the Sunshine Line and the CTC evaluation, I'm going to ask if we can't move through these rather quickly, since we've taken up quite a bit of time with the presentations this morning. Scott Clark, is he here with the Sunshine Line?
Good morning, Madam Chair, board members, staff, guests. Scott Clark, Director of Sunshine Line. I want to start off by expressing my appreciation for the Sunshine Line staff for all their hard work and dedication. They never cease to amaze me as they continue to provide service during these times. I'd like to start off by informing the board that we are tracking the tropical storm Laura right now, and we are preparing for potential evacuation should that come near our area. So that made a shift in our priorities. A few things: the HART agreement for a bus pass program was approved yesterday at the board meeting. Also, Karen Smith, she's working with HART staff on the electronic bus pass program, as they switch from the paper bus tickets onto electronic swipe cards. Some of our service, our daily trips are between 150 and 200. That reduction in trips, like we talked in previous meetings, allowed us to practice social distancing. Our Saturday trips are between 40 and 50. We're doing a lot of other things besides just our normal TD service. Our quarantine and isolation reverse transportation, we're taking people who were COVID positive and had tested negative 2 times, and they need to return back to their nursing homes. We're providing that transportation, and also for the quarantine and isolation hotels and alternate care sites. We've done 68 of those trips so far. We have a meal delivery. We're working with Aging Services on meal delivery. We're delivering meals to seniors. In June, we delivered 1,493 meals, and July, 2,272 meals. We're working on vehicle purchases and installing vehicle barriers for the drivers. We're looking into that right now. Also, we'll be implementing panic buttons for our drivers in November. So if there's an emergency on the bus or while they're in service, they can press that panic button and it will alert the office and also maybe law enforcement, depending on the level of the threat. And we continue to practice our safety controls here in the office and on the road. We've I just purchased video cameras for the office staff who are telecommuting to help prevent that feeling of isolation and disconnection. So when they have their meetings, they'll be able to see their peers and their supervisors and managers. We also implemented a driver survey to assess the level of anxiety and stress and confidence with the safety controls. And we should be ending that survey pretty soon. So far, it looks very good that the drivers feel safe and they are confident. And that's all I have. Anyone have any questions for me?
Thank you. Mr. Brown, did you have a question? Was that a?
That was just a thank you, Scott. Appreciate it. Always like to hear from him.
Yes, me too. Thank you very much. Especially interesting in this time of so many emergencies heading our way. Are there any other questions or comments for Mr. Clark about the Sunshine Line?
And I also sent a email to Dr. Jang to make connection for the Healthy Buddy program.
Cool.
So,
Cool. All right.
Thank you all. Thank you for your support.
Thank you. All right, great. Hearing no other questions or comments from the panelists, our next item is Mr. Barber with performance, with the CTC evaluation. Mr.
Thank
Barber?
you, Madam Chair. Yes, I was on mute. Apologies. Just a quick update. We finalized the CTC bus pass and door-to-door surveys, and those have been sent out. I expect them to be fully returned by September 1st, pending no problems with USPS delivery. So sometime in mid-September, we'll be doing that data analysis. The CTC evaluation is ongoing currently. MPO staff is conducting that. We're hoping to have a draft report for either the October or the December LCB board meeting for review and finalizing. And I would ask the committee if there's anyone interested in volunteering to help review that document before it comes to the board. We'd be welcome to have you. So that's all I have. And that would be with Karen, Scott, and I. We'd just be reviewing the document and talking about the findings and, you know, that kind of thing.
I can probably do that, Joshua, if you need me to. It's Glenn.
Thank you, Glenn.
All right, any other questions or comments? Seeing none, that about wraps us up. Our next meeting is October 23rd, 9:30 a.m. Our governor has extended the use of virtual meetings through October 1st, but indicated that they may not be extending that. So we'll let you know how things go by October 23rd, whether we'll be meeting again virtually or in person or in some possibly some hybrid mix. We'll work on that.
Yes, we will.
All right. with that, is that if there's no other new business from board members, any suggestions for topics or anything that anyone wants to bring forward before we adjourn? That didn't sound like a board member. That sounded like a pet. All right. Seeing none, then we'll adjourn the meeting, and I'll see you all in October. Everybody
Thank you.
stay safe, stay dry, take care.
Thank you.
Thank you.
Nice seeing you all.
Thank you, Madam Chair. Thank you, everybody.